whether, I think in our hospital we saw some linen comments, or we saw, the garbage was overflowing at a certain time. But then you can actually make real-time changes based on those comments. You can also address issues that somebody's having while they're in the hospital, and then that way, 4, 5, 6 weeks later, when they sit down to fill out the HCAHPS survey, or even if they don't, they're they remember their hospital stay, and they remember, oh yeah, Dion did come into my room, and he did address those issues. And so it really is a great time to kind of get a feel for what's going on individual floors, and then follow up with those comments, with those themes to our teams.
So we're coming to the end of our session. What other best practices that we haven't addressed or talked about while we have you, and we're fortunate enough again to have you join us? Any other suggestions for the environmental service leaders out there? Messages for environmental service frontline team workers? What else can you share with us?
Yes, I mean, just overall, I have to say thank you. I think a lot of times, the media and people end up shouting out doctors and nurses who deserve, a ton of credit. They go in every day and they save people. But our housekeepers, our EVS staff, are going into those same rooms. They are, putting themselves at risk in the same way. So, number one, I have to thank every EVS worker out there through this pandemic. I really appreciate everything you guys have done. Number two, now we're coming back to HCAHPS, and people are going to be grading tougher. They're going to be grading tougher on cleanliness. I feel our hospital is incredibly clean. Oftentimes, it's perception. And then, a lot of what we can do, we talk about, is communication. We can talk about what we're doing in the room. We can ask if anything else needs to be done. And finally, just that whole hospital list. Keeping the hospital clean isn't purely an EVS job. Every single person that comes to work at the hospital needs to contribute, needs to own the hospital, and to make sure, that things are clean. One of the man I was working with, we were talking about it, and he says every time he sees somebody with their foot on the wall, he kind of jokingly says, "Come on, man, come on, what are you doing?" And you put your foot up on the wall, or you drop a mask, and that makes an EVS person have to pick it up or clean it up. And it takes time away from times that they could be spending cleaning a patient room or communicating with the patient. So it's not just on EVS, it's on everyone who works in the hospital.
That's a very great point. I was talking to a group of environmental service employees a little bit about diversity and inclusion. And one of them said something really profound. They said that sometimes they get judged on the job they perform versus the value they add to the patient experience. And I just thought, wow, everybody contributes to the patient experience, but the role that we each play should not, be understated, especially with environmental services. We often talk about how important the role is and how courageous, especially in COVID-19, but really in all times, they are to be able to disinfect and clean some of these spaces and be willing to do some of the things that not everybody is willing to do. So thank you for sharing that thought, Ben. Around the room really quickly, any final thoughts? Jeff, then Dr. Carr, Dion.
Yeah, I just want to go back to something that Dion said about being able to put on the special touches, and that's definitely one of the benefits of rounding from a leadership perspective. But I would also say that good communication, as Ben is talking about, but also getting people energized to project more, to be more engaged in that interaction pays dividends in the long run, because the hospital that I work at currently, we have a very engaged team, and a lot of people are making great strides to connect with patients because they genuinely enjoy it as part of their job. I remember some other hospitals that I've worked at in my career where, sadly, the only real interaction that a patient had was with a housekeeper or an environmental services technician. For whatever reason, their connection with their doctor or their nurses wasn't the greatest, and it was the housekeeper that was doing more to kind of salvage that experience. So I say that as a reminder to don't underestimate the power that a good housekeeper has. And back to that statement, a little bit of housekeeping, a lot of humanity. The front line definitely has a lot, and when we support them, that really can go a long way. So something to think about it from that regard.
Absolutely. To piggyback off of what Jeff said and what everyone else has been saying, is that is so true. I think we mentioned this last week where I stated that environmental service is, without environmental service, we can't even start the process of taking care of the patient. And unfortunately, as stated numerous times, environmental service, they're shunned upon or looked at, oh, they're not that important. But the honest truth is, you all are the beginning and the ending. And if you do not clean the room, patient care cannot take place there. And if you do not come after the doctors have performed, that room has no purpose. So we have to keep that in mind. And again, just remember the importance of our staff, no matter what uniform they wear into the facility.
Wonderfully said.
My take on this podcast and the name of the podcast was it took a lot of thought. Part of the thought is I listened and I got the name actually from what a patient said to me. The patient said to me, I feel so comfortable knowing that the room is clean. I said, wow, that's a podcast. I feel so comfortable knowing that the room is clean. Because if she wasn't comfortable, she wouldn't sleep well. If the room wasn't cleaned properly, if the room wasn't disinfected well, she's so afraid of catching something from someone else. So she's counting on us for a clean and comfortable stay. And I think that's my take on the whole thing. Liz?
Well, Ben, thank you so much for taking the time to share your experience, your knowledge, the best practices, and to ensure the best possible patient experience. And we would love for you to join us again on one of our next podcasts. We really enjoyed speaking with you, and thank you for everything that you and the patient experience team do to ensure that our job is just a little bit easier and we can get the right messages back to our team to drive their engagement and, again, the best possible overall patient experience. Thank you so much.
Thank you, Liz. And one last thing, tough time in America, tough time in New York. Just check in on each other, check in on your staff, make sure people are okay.
Yes.
Thank you. Great. Yes.
Good night.
Thank you, guys.
Good night, everyone. Thank you for joining Clean and Comfort.
Absolutely. Good night.
Good night.
Night.